So one of our needs is to have a diverse surgical group, okay? And another one I've mentioned already is our maldistribution of surgeons. We have enough surgeons at the moment to service our population needs of 20-odd million people. However, we still have huge disparities of where our surgeons are. And so there's a push to keep increasing the number of surgeons who we graduate. Now, there's no doubt if we don't do that, in 10 years' time, we will have a shortage of surgeons. But I think the problem is made worse or exacerbated because the number of surgeons who we are graduating are pretty well metrocentric, okay? Are pretty metrocentric. And I'm not preaching to you to say you should be all going out to the rural and regional areas, because here I am in Adelaide, okay? And I'm based here. I mean, I do rural work, but I'm based here. So, but again, it's important to understand that, in fact, the government is actually pushing for the colleges, and particularly the College of Surgeons, to actually look at training, recruiting, training and retaining surgeons in rural and regional Australia. And what that has meant in terms of selection is that if you come from a rural background, you will actually have additional points to be selected into surgery, because that is now seen as an important merit other than your other academic achievements, that it actually has merit to be coming from a rural background. And there's some very strong, consistent information or data that says if you have a rural background, particularly studied and educated and grew up in the rural place, then you're much more likely to go back there and work as a doctor or a surgeon.